their lives.
All ages that are in need of immediate medical attention to save their lives. He'll also be able to talk about some of the challenges that are being faced by the medical community across our state. First, an update on the federal side. Saturday night, I was called that we have successfully secured in Colorado a major disaster declaration from the federal government for our state of Colorado that unlocks access to additional resources. We were able to announce that Saturday night. I want to thank the President for granting that request and most members of our congressional delegation who supported that request, which really underscores the seriousness of the challenge that we face in the days and the weeks and indeed the months ahead. Now, in a practical sense, this declaration is a prerequisite to greater emergency assistance, but it's also an important recognition of what's already occurred and the lives that are already lost and those who are transformed for forever. This also helps make sure that Colorado can compete on a level playing field with states like New York and Washington when it comes to emergency assistance. For instance, it helps make sure that the National Guard is placed in Title 32 status, which means the federal government is paying for their activities. Just this morning, I spoke to the President and the Vice President about the need for this being placed into Title 32 status, as well as the need for the ventilators in Colorado, 9,000 to 10,000 more. We discussed some of the parameters around the timing for those as well. This status also ensures the federal government will help pay for more of the costs associated with this disaster, everything from transportation to care to food and water and essential items at distribution points. This designation, combined by the very robust package that Congress passed and the President signed, is really critical relief for our already overtaxed emergency management. We're looking forward to further increasing that capacity in the days and months ahead. I also expressed to the President our gratitude for the important work of the Colorado National Guard and the Army Corps of Engineers already on the ground here in Colorado. The Army Corps of Engineers helping with additional bed and hospital construction. The Colorado National Guard has supported over 10 drive-through testing sites across our state. And I just want to express our profound gratitude to the people of Colorado, just as I did to the President of the United States, for the critical help of the Colorado National Guard and the Army Corps of Engineers in this critical time. I want to have a few slides that I wanted to go over with you here today. But before we do that, I just wanted to talk about how this crisis will be with us for days and weeks and indeed months ahead. And it's important to pace ourselves in this, just as we are and the people here at the Emergency Operations Center, just as you are. We need to get through this in a sustainable way, which means finding new ways to relate socially through online chats and video chats, telephone, reaching out to people in new and other ways. Just because we're physically distant doesn't mean that we need to be emotionally distant. In fact, this is a time when we need to be more together than ever before as we face this crisis. It's just one in which we can't be physically together. As 1 Corinthians chapter 13 says, 3 things will last forever: faith, hope, and love. And the greatest of these is love. And of course, that means faith in the broadest sense. It means faith in science and data. It means faith in your religious tradition. It means hold the faith in the important institutions that keep us together. It means hope. And of course, there's a light at the end of this tunnel, and for the vast majority of us, most of us, we will get through this as a state, as a nation, and as a world. The day will come again when we can get together, enjoy, and celebrate. That day will occur as soon as we're able to, of course. And in the meantime, the greatest of all these, love. That means love one another, love yourself, and make sure that we're reaching out and connecting more than ever before, emotionally with others through different technologies that allow you to do it without being in physical proximity. The President just the other day said that the social distancing guidelines are likely to be in place by April 30th. We know that it could be that date, it could be sooner, it could be later, but however long they need to last to save lives and prevent a longer-term disruption to our economy and to jobs, we need to make sure that we're all handling this ourselves in a way that allows for that sustainability, a way that allows us to reach out to our friends, to our family members, have those meaningful conversations and connect. My son and daughter were video chatting with grandmas. I'm sure many are. And during this time period, even if you're fortunate to have your grandparents and aunts and uncles living in a nearby vicinity, it's important that we particularly protect those who are most vulnerable. And since symptoms seldom manifest, and if they do, they're usually minor in our youngest Coloradans, we want to make sure that they're, to the extent they're interacting with their grandparents and aunts and uncles, that they're doing so virtually in a way that can even bring people closer than they were before. Now I want to update you with some slides that we have. This is the age graph, and Dr. Moss will also talk about how this is affecting people of all ages. Originally, while the higher percentage of older Coloradans are forced to hospitalization and could lose their lives, there are people in their 30s and 40s and 50s who are otherwise healthy in their prime that are forced into hospitalization, might need ventilators, it could even lose their life. I also have the partial update figures for today that show the continued growth of the virus in Colorado. As you know, we post our daily update figures at 4 o'clock each day at covid19.colorado.gov. Those will be posted today at 4, but I have a partial update now that we have 2,627 cases, 414 hospitalizations, 47 counties, 51 deaths, and 15,364 tests that have been completed. Tragically, in this last day, we also had our first death of somebody under 40 years old, again showing the severity of this virus for people of all ages. Now, that's one side of the coin, the severity, but it's also important to tell you that about 80% or more, 80-85% of folks who contract this virus do not require hospitalization, do not require intensive treatment, and will self-resolve. And if you do have symptoms of the virus, it's important that you completely self-isolate until at least several days after the symptoms have subsided. No fever, no symptoms, several days after. And that will cover 80-85% of the cases. So if you do have flu-like symptoms, COVID-19-like symptoms, don't panic. If you need medical attention, don't hesitate to get it. But if you're able to breathe and if you have a fever, experiencing coughing, if you don't need immediate medical attention, you need to stay in your home and self-isolate until several days after those symptoms have completely resolved. And of course, all Coloradans need to stay at home except when absolutely necessary. And we're going to talk about in these slides some of the success we've seen to date, but also the challenge we have to do even better with regard to having greater physical proximity from one another. Next slide. This is the nuts and bolts of where we are in supplies. This is approximately a 3-week time frame. We feel that after 3 weeks or so, 2 to 4 weeks, the larger scale industrial production will kick in. But we, as you know, have very urgent short-term needs. We're making progress on those. We need, and we express these, I also expressed this to the President today with regard to the ventilators. You can see that we had needed 654,095 masks. That leaves a deficit of about 200,000 in the next few weeks for what we've already delivered out to our care providers. A deficit of surgical masks, and we hope to make additional progress in that in the coming days. We have many irons in the fire. We have a wonderful team. We've pulled in top-notch people from the private sector, Sarah Thunberg, Casey Wolf, Matt Blomberg, and from other offices in the government. We've set up our innovation response team. They are working to creatively acquire these personal protection equipment in a really challenging global time frame when everybody's trying to buy them. So we have to be extremely effective. Many people have provided introductions, validations for purchasing orders that have been placed. We're hoping to acquire as many of these as we can here in Colorado. And frankly, we'd rather acquire too much than too little, right? We're going to use all the surgical masks and gowns and gloves that we acquire. We'd rather have as many as we can so that that surplus can last us longer. as the global pandemic worsens, but also we hope that there's enough for many of our other frontline responders, first responders, grocery care workers, and others. We hope that we have additional personal protection equipment besides those that are just strictly needed in the clinical capacity, which are obviously the first priority. You also see the deficits with regard to face shields, gowns, gloves, and coveralls. We have an excellent team that is working on trying every day, and we'll continue to keep the public updated about where we are with regard to these gaps. Now, I've been beating the drum for weeks, but we need additional personal protection equipment. We had very successful personal protection equipment drives. Many people and practices have turned in their extra equipment. This is the reason, for those of you who might be frustrated that you had to have your elective surgery delayed, this was the reason we needed in the short term all of the masks and gloves and gowns that would have been used in that elective procedure. We need them for the clinical setting for the COVID-19 patients in the hospital. So once that supply chain gears up, we hope that there will be a point in the future where those elected procedures, which again, for people, you know you need to have them, and I know it's a sacrifice that you're giving them up for several weeks. So we hope that we can address that equipment gap and those can resume. I want to thank Home Depot for donating 5,000 boxes of gloves. We deeply appreciate that. We appreciate all the donations from our private sector partners and others. And I articulated these needs to the President and Vice President this morning on the phone. Next slide. This is the time frame which when we talk about chasing the ghost, and we'll show you what this means, what we're going to be tracking today, and we're going to get to kind of how the spread of the virus is tracking and how traffic in our state is tracking using several indicators that we look at. But this is why there's a lag impact from when somebody is first exposed, 4 to 5 days, the symptoms. There are even cases of it being longer. 4 to 5 days seems to be about the average, but that doesn't mean that some don't have a longer incubation period. 7, 8, 9 days is not unheard of. Time to report date, onset to ICU, and onset to death. Next slide, please. So this is the important thing that we all will be looking for in terms of when these impacts hit. So what we are likely seeing now is the impact of the closure of bars and restaurants. That has just rolled on in the last day or two, meaning the social distancing that we gained, that we won, the delay in the spread that we won, and we'll get into what that looks like from the closure of the schools and the closure of the bars and restaurants is just going to be showing up in the data yesterday, today, tomorrow. That's what we're seeing. We won't see the impact from the 50% workforce reduction or the stay-in-place order for a whole nother week. And those are going to be very important things for us to track in real time. But that's why this compliance is so important. The more that we can stay at home, the more unnecessary times out that you can avoid, the more effective these measures will be, and the sooner that we can return to being able to support ourselves and earn a paycheck and more economic normalcy. Now, in setting expectations, we know that that new world is not going to look exactly as the old world. Of course, we're going to have to take additional precautions as people go back to work and as they are able to earn a paycheck as soon as we possibly can. There'll be more details on that when the time is right, and whether that date is April 11th or April 30th. Whatever that date is, that we can resume more normal functions of being able to support ourselves. We'll also have additional ways that people can protect themselves in that environment. But it all depends on the effectiveness of how these measures are taking in squashing the spread of the virus. And these are the key dates that you can look at, keeping in mind that, yes, you might see some impact a day or two before the observed impact date, and you might not see the full impact till 3, 4, 5, 6 days after the observed impact date. But we do feel that you'll see a demonstrable impact from these measures on the observed impact date that we indicate here. And so what we're going to be showing you today is likely the impact of the school closures, the prohibitions of gatherings of 10 or more, and the closures of the bars and restaurants. Next slide. Now, this is a hopeful slide, and again, there's good news and there's bad news in everything, but what it's showing is that the time to doubling, this is why this is such a scary virus. This was doubling every 2 days in our state, even less. I think there's a point where it's doubling every 1.5 days, the number of patients. That goes incredibly quickly. If you think about it, it's an exponential growth factor. We now, and this is just 1 day of data, and I want everybody to realize that we want to see where this number is over tomorrow, the next day. But at least now, as the effects roll on from the bar and restaurant closing, it looks like the average doubling time is approaching 5 days. So first the good news, that's a lot better than doubling every 2 days. Now, the second piece of that news is that it's still an extremely contagious virus, which shows why just closing the bars and restaurants wasn't enough. If you have 1,000 people in 5 days, it's 2,000 people. In 10 days, it's 4,000. And then 15,000, 30,000, 35. It still would spread and have an enormous peak, doubling every 5 days. That's very rapid. So it buys us a little time. Doubling every 5 days is better than doubling every 2 days. But we really have to drive that further, and that's what we're hoping to see with these additional steps as their impact rolls on in about a week. And we do hope that this number, which we'll be watching in the next few days, will help further reduce that spread. But we have successfully slightly delayed the peak and slowed the spread with the steps that were taken with bars and restaurants. And as these additional measures roll on, we really, really hope that this has a bigger effect. Now, a couple caveats. Of course, this is only based on positive tests that we've gotten back. We've ramped up testing, but we know that there's plenty of people who've been infected and haven't been tested for it. So another lagging indicator, a ghost that we're going to be chasing and reporting on, will be the number of hospitalizations. So that will lag several days behind this, but we're also going to show you how that is impacted as a trend. The hospitalization number is not necessarily significantly impacted yet by the bar and restaurant closures. That is rolling on now and in the next few days. Remember, time to detection, 8 days, the average time to hospitalization greater. So we're looking at all these lagging indicators to see the impact of what we did a week ago, 10 days ago, and it's why we want to make sure at any given point in time that we're doing enough, that we're taking the bold actions necessary to prevent our state from having an outright public health crisis as is occurring in other parts of the world. Next slide. So this is more real-time data, which will show what we hope will project onto the healthcare data after the incubation period and identification period is over. But we can see that all road traffic on both interstates, U.S. highways, and others shows a significant decrease since the closure order. That's some encouraging news. Now, traffic isn't a perfect proxy because it alone doesn't say whether people are just going somewhere and walking around safely or they're going somewhere and socializing with others, but it certainly is a good proxy. And for all of us, we need to heed this advice. Don't get in your car and go somewhere unless you absolutely need to, right? We want to stay at home to the extent possible. That's why it's called stay at home. Doesn't mean you can't walk your dog around your neighborhood as long as you're maintaining social distancing while you're doing so. But please do your best to stay at home. We are showing a 60% reduction of cars on the road from the baseline 4 weeks ago. Now, we hope that that means more than 60% social distancing, because 60% alone is not enough. We really need to be in that 70 to 80% range. But it is a positive indicator. Colorado Department of Transportation is providing this critical analysis, and this is being reported back to me, to our decision makers, to our state epidemiologist. We're getting hourly, daily, and weekly, hour over hour, week over week, day over day reports to see exactly what impact these measures are having. Traffic is a proxy for changes in behavior, and that can be the weekday work commuting or changes in the weekend that are associated with errands or with recreation. And during this time, we need to do our best to cut down the extent that we can. Please continue. Next slide. When we zoom from 12 weeks to 4 weeks, we see an even clearer picture of the reduction in traffic that shows daily total car volume in yellow and a trend line for the percent changes from 4 weeks ago in blue. It shows that car volume here, just as before, it's just a different visualization, is down 60% in the last few days compared to a normal run of the 4 weeks prior. So that's a good, healthy decrease, although we know we have a ways to go. Next, please. We can also break this down by highway, individual segments. This shows a summary of changes in interstate vehicle counts via interstate. also very important, decreasing by 400 cars every day. And we expect and we need that decline to continue. Please stay at home unless absolutely necessary. The more people stay at home, the more sooner we can squash this virus and people can return to work and supporting themselves. And that's the key message. It's a matter of individual responsibility, yes, to save lives, and that life could be yours or the lives of a loved one, but also the better compliance we have, the sooner that we can move to economic normalcy. Next slide. This is one that we want to talk about because it's so important. We can see the dramatic impact that these measures have had on the Eisenhower Tunnel, the main gateway from Denver Metro to the mountain communities. This is so important that our people are not treating this like a vacation and that people are staying at home. This is not a vacation. This is a very serious challenge for Colorado, perhaps the most serious of a generation, certainly the greatest public health crisis since the Spanish flu of 1918. But this is the key area that we're showing success in reducing that traffic right now. Because you know what? The mountains, our trails, our beautiful rivers, they're going to be there. They're going to be there for millennia. They're going to be there long after you're there. So let's take a few weeks and not visit some of these areas and just recreate in our neighborhoods to the extent you need to. Again, walking your dog. You can be active without having to be out, without having to drive anywhere. And that's going to be very, very important. And so clearly don't go into these hot area counties that have some of the highest rates in the state and country. Eagle County, Summit, Pitkin, they have very high rates of the virus and transmission. Eagle County has some of the highest rates in the country. So that's the last place that any of us should want to go. And for the residents of those counties, they're showing a strong stick-to-itiveness. Fortunately, their hospitals are built for tourist capacity. The tourists are gone, so there's extra capacity there for locals. We're so grateful for that fact that even though we have enormous number of cases in those areas, so far the hospitals have been able to keep up because those hospitals are built for the surge in population in hot tourism times, and those people are not there. We're just down to our local resident population. And so for now, at least, those are able to keep up. Keep in mind, they are also sending patients down the hill to the Denver metro area simply because for respiratory issues, often one of the first-line responses is get to a lower altitude, and that's a very normal thing, and that is happening. But because of the extra capacity that's built around tourism, those hospitals are not yet in crisis. Next slide, please. We are all in this together, all together, right? Showing love for one another, respect for one another. I'm enheartened by all the positive acts and giving that people have given, whether it's the over $7.5 million that has been donated by individuals at helpcoloradonow.org, the thousands of people who've signed up to volunteer, some of which are already being deployed in our communities. The acts of kindness that we know about, that have been covered by news and others, and the countless acts of kindness that aren't even being talked about. The fact that you are calling your 76-year-old neighbor and offering to pick up her groceries and delivering them to her doorstep. The fact that you and other families, some people are putting bears in their windows so passersby can see those. Some are putting up their Christmas lights to keep their family busy with an activity and to light up their neighborhood. I know you're doing all sorts of things in this challenging time. And I know that it's a sacrifice. It's a sacrifice for you, of course, going without the things that are an important part of our Colorado way of life. And it's an economic sacrifice for those who are living paycheck to paycheck and don't know how much longer they can go on without earning that paycheck. We want to thank the federal government for the fact that Coloradans will be getting $1,200 per person, $500 per child soon. Student loan interest payments have been suspended for many months. We've acted in the state to delay the need to file your federal income taxes. We also offered to match local jurisdictions that choose to delay their use or sales tax. We will also delay the state component of that. What remains to be seen and what we're trying to do is significantly slow the rise and the spread of coronavirus in Colorado. And these initial measures, the bar and club closure, is already showing its impact. We fully expect that these additional separation measures, as long as people are following them, will also show reduced spread of the virus in Colorado and help us all return to be able to support ourselves and lessen the need for more extensive measures over a graded period of time. I want to ensure that you get to hear some of the same stories that I hear firsthand about the situation from someone on the ground, really as a front response frontline response to this virus. Dr. Mark Moss is the head of pulmonology at UC Anschutz and a doctor at UC Health. Dr. Moss stepped away just today from his important duties to attend this press conference to help share with you really what's going on from a clinical perspective, what he's seen with his patients. He's representing, of course, tens of thousands of Coloradans in the medical field who can't be here now because they're risking their lives to save the lives of our friends, neighbors, grandparents, and ourselves. I want to thank all of our medical workers, from those who clean our hospitals, to the nurses, to the paramedics, to the doctors. Dr. Moss will hopefully help give an articulation of some of what you all are seeing. But I know that of all the Coloradans who are making a sacrifice, those who are making a sacrifice, yes, we find it difficult to be at home all day and not go out, but we know that our medical workers putting themselves at risk of exposure every day, working double shifts. You are really in the front lines of making a sacrifice to save lives. With that, I would like to turn it over to Dr. Moss. Dr. Moss?
Governor Polis, thanks for the invitation to speak with you today. I'm the head of the Division of Pulmonary Sciences and Critical Care Medicine at the University of Colorado School of Medicine. I mostly work in the intensive care unit at the University of Colorado Hospital, caring for critically ill patients. As a pulmonary or lung specialist, I've been on the front lines of the response to the COVID-19 pandemic, a respiratory illness that injures the lungs and causes a severe viral pneumonia, or something called the acute respiratory distress syndrome, or ARDS. Due to the COVID pandemic, we are now caring for an unprecedented number of critically ill patients. We have had to mobilize extra teams of doctors and other healthcare professionals, and now have twice as many critical care doctors working continuously throughout the day and night to effectively care for these very sick patients. As of this morning, we have 72 COVID-positive patients in the University of Colorado Hospital, of whom 37 are critically ill in the intensive care unit, and 33 of the 37, or almost 90%, are on mechanical ventilation, which is a form of a life support system. This represents a more than doubling of the number of normal number of patients we care for in our medical intensive care unit service, and we're only at the beginning of this crisis. It's important for the Colorado community to understand that coronavirus does not target only older Coloradans and those with underlying medical conditions. Though older people and those with underlying medical problems have a worse outcome if they contract the virus, the COVID patients we are treating are on average in their 40s and 50s, and some are as young as 19 years old. Many of these patients were healthy with no other pre-existing medical problems. So I want to emphasize that healthy people can be infected with this coronavirus and become critically ill. This pandemic can affect anyone. I also want you to understand that once hospitalized, we're observing that COVID patients can go from requiring a bit of extra oxygen to needing to be put on a ventilator or a life support system within a few hours. However, it takes a much longer time for them to get better. The critically ill COVID patients that we are now treating are at the beginning of a very long road to recovery. In general, those who are fortunate to survive will, on average, remain on the ventilator for 2 weeks. Sometimes it can take even longer. New COVID patients are being admitted to the hospital at a faster rate than patients are recovering. And as a result, the hospital census is steadily increasing, putting even more strain on our capacity and our resources. All across the state, our frontline providers are working in a difficult and scary environment and literally putting their lives on the line for their patients. We're learning from the experiences in other countries about how contagious this virus can be. In Italy, more than 50 doctors have died from COVID-19 that was contracted from caring for other COVID-19 patients. In Colorado, we are unfortunately starting to see healthcare professionals test positive for the coronavirus. This is not only devastating to these medical professionals and their families, it hampers our entire response because it sidelines critical medical staff at a time when we need them the most. One example is my colleague, Dr. Catherine M. She's an excellent critical care physician. A few weeks ago, while caring for patients in the intensive care unit during the very beginning of this pandemic, she started to feel sick. High fevers, chills, sore throat, cough, and shortness of breath. She quarantined herself and eventually tested positive for the coronavirus. She's now fully recovered from COVID-19, is not contagious anymore, and keeps asking me when she can go back to work. She'll start taking care of patients again next week. I've never been prouder of all my colleagues and the amazing hospital employees that we work with on a daily basis. You'd be honored to witness their extraordinary efforts to care for our sickest patients. They're working long hours in difficult conditions, putting on and taking off personal protective equipment while trying not to get sick themselves. Why do we take these personal risks? It's because it's a privilege and an honor to care for patients. However, I do worry about the mental stress that the COVID-19 pandemic is causing on our critical care providers. Working in conjunction with hospital leaders and our state and local public health departments, our healthcare professionals here in Colorado have created a forward-thinking plan to address the coming surge of patients. Due to intense preparation, we're able to stay ahead of the curve. I'm grateful that we're seeing improvements in important rate-limiting steps, such as diagnostic testing. The time to get test results is shortened from several days to less than 24 hours. This allows us to conserve personal protective equipment by only using it for patients that are truly positive for the coronavirus. But in order to be successful and increase the number of lives that we can save, we need two things. We need more equipment, and we need Colorado to take the pandemic very seriously. First, due to the intense preparation at the University of Colorado Hospital, we currently have enough personal protective equipment to care for these highly infectious patients. However, as the coronavirus continues to spread, we will need more personal protective equipment, including masks, gloves, gowns, face shields. We cannot care for our patients if we're not healthy ourselves. As healthcare professionals, we made a moral commitment to properly care for any patient in need. Last night I had a conference call with national critical care leaders to begin the discussion about how to make proper ethical decisions regarding the rationing of resources of things like ICU beds and ventilators. No one wants this pandemic to get to the stage where we do not have enough ventilators for each patient who needs one. Right now we have enough ventilators in the University of Colorado health system. However, we need to stay ahead of the surge and properly prepare for possible shortages of supplies now. In order to honor that commitment to our patients, we need an adequate supply of ventilators, medical equipment, and medications. So what can we do as a community? The most important thing you can do is decrease the spread of this virus is to stay home. And if you must go out, as the governor said, maintain social distancing and wash your hands frequently. We all need to limit our interactions as much as possible to slow down the spread of the virus. Our healthcare professionals, my colleagues, are working as hard as they can under stressful conditions to save the lives of your friends, your neighbors, your family members, and even maybe you. We cannot risk overwhelming our healthcare system. These social measures might seem onerous, but they're absolutely necessary for the time being. Before I close, let me read a text message I received this morning from a dear friend who lives in Colorado but flew back to New York last week because her mom became ill. Mark, thank you for all your kindness. Within a 12-hour span, I lost my dad and my mom. This has been a science fiction horror film. More when we meet again. Please be safe. The COVID-19 epidemic is real, and it's scary. We've never witnessed anything like this before in our lifetime. And on behalf of all the doctors, nurses, and other healthcare professionals, I want to let you know that we are and will remain relentless in our dedication to provide the best care to our patients. It's what we do.
Thank you, Dr. Moss, for sharing that powerful story with you. Really about faith in science, faith in the Almighty, faith in our public institutions and the hard work of our medical professionals. It's about hope. We will get through this together. Most of us are going to be just fine, although most of us won't be any strangers to loss. And of course, love. Showing love now. It's exciting to see the fact that people have adopted more pets, and many of our humane societies have been fully adopted out. It's exciting to see that people are offering to deliver groceries for their neighbors. It's exciting to see that people are doing everything they can to show love for one another, of course, those dearest to you, our families. We should do your best in the difficult circumstances to really cherish this time together with your families and spread that love to your greater extended family, to your friends, to those you haven't connected with for many months or many years. We can get through this together, and the hope will be all the brighter the more love that we can show one another during this crisis. Thank you for joining us, and we'll take some questions.
The recording has started.
Yes.
Q&A session has started.
We'll do in-person for Stefan, and then we'll alternate.
Governor, if I could ask the doctor a question. Doctor, first of all,
Yeah.
happy National Doctors Day, and thank you.
Thank you.
On behalf of everyone watching what you do. We've all seen these stories out of New York State and what's going on in Central Park and the refrigerated trucks and the Javits Center. Are you concerned that possibly can be spreading as the days and weeks go? And could we be seeing a similar thing here in Colorado?
I think what people are trying to do is prepare for the worst and hope for the best. So I think one thing that the hospital systems are doing is making sure we're prepared for almost anything that can happen. As the governor said, we can model things out, and they're models. They help us understand things, but none of them are accurate. If we could predict the future, we'd probably all have different jobs that way. So I'm concerned. I've never seen anything like this in my career. There are intensive care units filled with people that look like you and me that are on life support systems, and they were healthy a week and a half ago. So it's concerning. I think the measures that the states put into place with social distancing are clearly the right things to do to try to spread or decrease the spread of the virus. But I'm concerned.
And remember, the average hospital stay is often in excess of 20 days. So this is when people need the medical intervention, they stay in the hospital for a long period of time. So that's why you need more and more beds, because it's not like you're there for a day or two and then you're discharged. They're showing a week, 2 weeks, even 3 weeks of hospitalization, although part of what is being looked at, of course, is stepping up or increasing the step downs to the extent possible, both for COVID patients and non-COVID patients. And keep in mind that amidst all this, amidst the onslaught from the COVID-19 patients, we have all the normal work that the hospitals do. Coloradans still have heart attacks. They still need appendectomies. They still have liver failure. They still have strokes. I mean, all that's still happening, and that takes up a lot of the beds. And we want to be able to continue to save people under those circumstances, too. There's going to need to be, emergency open heart surgeries in Colorado during this crisis. So it's about building this capacity on top of all the normal things and the normal work our hospitals do. Again, certainly delaying anything that's elective, but there's a lot of life-saving procedures that are not elective and need to be done in real time. Telephone, please. Telephone?
This is Nick Belchuda from Bloomberg News in Denver. In High Country, do you suspect that the outbreak in the High Country led to the spread of the virus in Denver metropolitan area and other parts of the state, and perhaps because of the skiers and tourists that frequent the area? Thank you.
So we simply don't know the answer for short. It seems likely that we had community spread and an endemic presence of the virus in the Denver metro area, just as it is in all other major metro areas of the country. Was it probably made worse by people who were up in the high country visiting with travelers from across the world who then returned to the Denver metro area? That is certainly a likely scenario. But even in cities that don't have adjacent world-class resorts or ski areas, you are seeing the community spread of this virus. So it might be something that affected where we are in a period of days or weeks to where we would have been. But certainly some of the highest rates in the country, Eagle County in particular to a lesser extent, but also Gunnison County, Routt County, Garfield County, and Pitkin County, because they are places where people mix from across the world. So Denver would likely have it anyway, and it would be spreading anyway, but it is a little bit accelerated because of the visitation to those high country areas.
Governor, some models suggest the peak in Colorado may come on
does end on April 11th. President Trump has extended social distancing till April 30th. Are you considering extending the order past April 11th?
Yes, the new federal guidance, President Trump said April 30th. Obviously, he expressed his initial hopes. I hope we all would have shared that by Easter Sunday, this could have been resolved in a way where people can attend Mass or go back to work that following Monday. That seems increasingly unlikely. The President now has a goal of April 30th. And whatever those steps are, it's likely that additional steps will need to be taken beyond April 11th. We are working. I just spoke to the head of CDPHE today. One of them, we keep many different groups. I speak to the hospital operators regularly. I speak to pastors from across the state regularly. One of their concerns is how they can physically orchestrate a successful Easter Sunday experience for their parishioners. So we're looking at what the parameters would be for a drive-in type Mass where everybody would stay in their car, and some of the large churches want to do that. But at this point, it's very unlikely that April 11th date will be the date, given that President Trump has moved it to April 30th.
And just to follow up to the doctor, how many of the younger patients under the age of 50 had pre-existing conditions? You hinted that many of them were healthy, but are pre-existing condition patient a little more susceptible to having to be in the ICU for COVID-19?
Yeah, I mean, the answer is yes, but it's not exclusive, right? So if you have pre-existing medical conditions and you're slightly immunocompromised or your immune system doesn't work well, you're diabetic, things like that, it increases your risk of getting it. And if you get the virus, it increases your risk of having a more severe course. But it's not 100%. Right? So there are other factors that play a role in why some people get infected and others don't. And I think the important thing is everyone has to take precautions, because there are younger people that were otherwise healthy, that didn't have medical conditions, that contracted the virus and are critically ill on life support systems.
Telephone, please.
Governor Polis, this is David Clue from Denver 7. Your supply tracker shows a huge deficit in PPEs as you anticipate this going on. President Trump says states like ours must be stockpiling these supplies because the feds are supplying everything we need. Have you had interaction directly with the president, and are you happy with the federal response?
I have not heard the president say to me that they are supplying everything that states need. So we've been operating on the assumption that they are not. And we've been aggressively working both international supply chains as well as gearing up our Colorado manufacturing capacity around personal protective equipment. We'll be happy to give an update, a full update on that in one of our later press conferences. I can pull in some of the folks that are working on that. We wanted the lens on this one to be more what doctors are seeing in the hospital. But we are not operating on the assumption that the administration will be supplying what we need, and we're increasingly confident that we will have both the domestic Colorado manufacturing on an emergency basis, and we're working directly with international supply chains, both as ourselves, the state of Colorado, and also the hospitals that are in Colorado working their supply chains. Yes. So those were some of the first actions that we took, some of the very first things we knew about this virus without yet knowing its trajectory in Colorado. And obviously we still don't fully know that, where information is developing on a daily basis. But we knew that it disproportionately affects the most vulnerable. And you're talking about death rates and the elderly in the 10 to 15% range in some cases. Very, very dangerous, and a much higher hospitalization rate as well. So we took those actions around severely limiting and ending visitation in many of our nursing homes and senior centers, checking the staff on a regular basis, as well as anybody who enters that building, doing a health check, just as you had when you entered this building. Your temperature was taken, my temperature was taken for those at home. Yes, no one's exempt, not even the governor, of course. They put a bracelet on me today. I was 97.6. I was running low, which is good. But everybody had their temperature taken and answered some simple questions, as did I. Some of you are wondering why I'm hoarse. It's actually from yelling at these press conferences. So it's a little hard on my voice. I'm talking softer at this one, but at the last one I was talking too loud for my own good, and so I've been suffering the fate over the last few days, as well as been so many conference calls every moment of every day. So my voice is a little bit tired, but it's not a sign of illness. It's just simply using it too much. So we took every step possible for reducing visitation, for checking the workers, and immediately acting when we do have an incidence in a nursing home, as well as prioritizing those test results.
Position. Wanted to ask, you mentioned how you've been on a conference call with other national hospital
Yeah.
leaders about having to make those critical decisions if there is a shortage and you can't help everyone. Are you concerned about possible medical malpractice claims, things that can come out of that? And are you working with leaders to create possible laws that could alleviate some of those problems?
Yeah, so the kind of the ethical leaders in the field were on this call, and they've published guidelines, not just guidelines, in medical publications like JAMA. One of the gentlemen, or one of the physicians, is by the name of Doug White, who's at the University of Pittsburgh, and they came up with a kind of guideline templates of how these decisions would be made if we need to make them. As I said, nobody wants to go down that road, but it's always good to be prepared so that if those issues do come up and we have to make ethical decisions, we do it in an legal, ethical, and moral way that makes decisions for the right premises and reasons that way. So we're starting the process, but I think the better way of looking at that is let's make sure we have the right supplies, we don't run out of ICU beds, we don't run out of ventilators, so we don't have to make those very difficult decisions that way.
Telephone, please. Telephone?
Governor, two questions for you. First, Governor Polis, should schools start prep? This is Chris Vanderbeek at 9 News. Should schools start prepping for for distance learning? Should they start preparing for that to last through the end of the school year? And then my next question is for Dr. Moss. Beyond the issue with ventilators, what is your concern that you will have the staff necessary to monitor the patients in your ICU and on ventilators?
I want to thank our superintendents, our teachers, our principals across the state. I had a call with all of our superintendents last week. I'll be touching base with them again this week. Thank you for teachers for doing things a little bit differently and being willing to learn the new technology, whether it's Google Chat or Zoom or whatever your district is using. But many districts are back at school today. Some have spring break this week and aren't back till next week. Others have an extended spring break. They went from 1 to 2 weeks and they're coming back next week because they want a little bit more time to prepare. But the districts that are back, thank you for getting back. It's great to have those kids learning. It's a relief for the parents. I see that as a father of an 8-year-old and a 5-year-old. But it's also really important that while our children will remember this event for their whole lives, we don't want them to lose that year of learning. They all need to be ready to advance to the next grade level. Our seniors will always remember, of course, this crisis that's canceling very likely the physical ceremony around their graduation, but they still need to be prepared with able to master the high school level content and ready to go to college or the workforce in the fall. So I know it's asking a little bit more of our teachers, our superintendents, our principals, everybody in education. Thank you to the school districts that are stepping up. And for those that aren't, you got to step up. We can't let the education of our kids suffer these next 2 months, and it's important that the kids have that schedule in place psychologically as well. It's very important they have that routine in place for our kids to be able to attend school virtually while it's not in session physically. So yes, many districts are going back this week. Some extended spring break. Some have spring break anyway this week and are going back next week. That's all happening across the state. It's very important, and it is very likely, the guidance that we gave to superintendents is very likely that you won't be able to resume normal classroom activities this school year. That's very likely. School year hasn't been called off yet statewide. We're always hopeful, but districts are preparing for that. That's the likelihood. At the same time, there's safe ways that they can use their school buildings for childcare, for emergency workers, for kids who might not have access at home to be able to have access in a way that's safe and appropriate, coordinate with their county health department. There are ways the school buildings can be used, but it's not going to look like the normal school day. That's becoming less and less likely for that to return this year before the end of May. Dr. Moss?
So it's a good question about person power. Do we have enough healthcare professionals to care for the patients? I think the issue with that is we've done a very good job of preparing. I don't think you can be over-prepared for a pandemic like this, and people have been preparing to try to figure out different models of how to care for the patients. Is it a concern? Absolutely. The dean of Cornell Medical School, who's a pulmonary physician, the head of the pulmonary division at NYU, sent out a notice through the pulmonary community around the country that said they need help. They need doctors to go to New York and help take care of patients, and people are reaching out to try to help them. So it's a concern. I think the important thing is the medical community in Denver and the critical care physicians across healthcare systems and hospitals have been working together to figure out how we can help each other. So I think we'll be okay. For right now, we've modeled things out that we can accommodate 3, 4, 5 times the number of patients at the University Hospital, and I know all their hospitals have done the same. It's more than just doctors, just to keep that in mind. We need to make sure we have enough nurses. We need to make sure we have enough respiratory therapists. We need to make sure we have enough physical therapists, occupational therapists, etc. So it's more than just a physician issue, but I'm confident that people have prepared accordingly, that I think we should be okay. But as I said, New York's an example where they need doctors. They need people to go there to take care of their patients. We're a resource too. People are talking about ventilators and personal protective equipment. Healthcare professionals are a resource also. The last thing I would say is that the other concern about that is what I raised. That's assuming everyone stays healthy, right? If healthcare professionals get sick, they can't go take care of patients. And in certain areas, like in Seattle, they've estimated that somewhere up to 25% of the healthcare professionals have contracted the virus. Whether that's from taking care of patients or in the community is unclear, but we have to account for that also, that people are going to get sick, and that's going to decrease the number of personnel.
Doctor, before you go back,
Yeah.
you guys can switch again. One healthcare professional told me that the thing about this virus that's so frustrating is there's not a set treatment, and you have very few things that you can do for people who get sick with this, give them oxygen and put them on ventilators if they get that bad. Can you talk a little bit about that frustration and what treatment techniques you're using and what's working and what's not?
Yeah, so it's a very good question. As I alluded to in the beginning, what these people develop is something called the acute respiratory distress syndrome, or ARDS. Of interest, it was first described in 1967 in a case series of 12 patients at the University of Colorado Hospital. So this was discovered here in Denver. It's common. It occurs in general over 200,000 times a year in the United States, and it's a common reason to be in an intensive care unit, and it's a common reason for people to pass away from being critically ill. There are no known medical treatments for patients with ARDS, but there's a lot of other things we do that has very evidence-based with how we adjust the mechanical ventilator so that it properly gets oxygen into the body and carbon dioxide out and doesn't injure the lung. So there are clearly things that we do for these patients that are beneficial and improve their chances of surviving. The question you're raising is there are no medical therapies, there are no drugs we can give these patients. And that's a real big ethical dilemma of how to address that issue. There are people out there that want to just give medications because I think they might work. I'm old enough where I started my training during the AIDS or the HIV epidemic, and it was a different time frame. It wasn't as acute, but there was as much concern there. And I think the most important thing is the only way we're going to figure out how to properly treat patients with COVID-19 is to enroll patients into clinical research trials. And I can tell you I've been on National Institute of Health boards over the last few weeks to try to figure out how to most effectively to start trials like that, get them finished in a short period of time. So in a few months we really do know, or a few weeks, we do know what are the right treatments. So there are things we're doing. They're not medications, but there are things that we're doing to effectively treat these patients.
Yeah, and there are so many rumors out there, and it's important that people apply a scientific eye to the data. It's frustrating to me that even some people that are doctors, they're obviously not researchers, but they're doctors, are saying irresponsible things. Like, I had 11 patients and we did this and they all got better. Well, that doesn't mean much because 11 might have gotten better anyway, even if you didn't do that. So it's all being thrown out there. Maybe it's important because some of those can be picked up from the research end and looked at. But there's going to be, 9 dead ends for everything that's promising. And some of those dead ends might be counterproductive in terms of side effects clinically. So everybody is trying things out and learning as fast as we can, but it's extremely unlikely there'll be any silver bullet. There's likely to be better practices and perhaps treatments that increase the survivorship rate over time, but it's unlikely that there's going to be anything that's a game changer in the short term. Telephone, please.
This is Jessica with Denver 7. We've received a lot of viewer emails and phone calls regarding vaping and the spreading of germs. Has your office considered banning the sale of vaping products or tobacco products during this health crisis?
Well, many retail stores are closed. There's obviously people that are addicted to nicotine and people that are addicted to alcohol, and particularly, and obviously there's people that have other chemical dependencies, and they need to, obviously, in their own time frame, we hope that they overcome those addictions. But for those who use nicotine and alcohol, we don't want to create a panic situation unrelated to this public health crisis.
Governor, the rent is coming due in a couple days for a lot of Coloradans. We've heard from a lot of people who say some landlords are giving breaks, other landlords not. Have you considered a broader action to help tenants, and have you been in contact with some of the apartment communities?
Yeah, there should not be over the next 30 days, and this should certainly be the case through the end of April. I think the current one goes a little bit earlier, but there should not be evictions that are enforced except for public safety reasons. Like if somebody's running a meth house, they will be evicted. That's an urgent matter. But for non-payment, there should not be evictions. That is the guidance that's been issued. Our state resources will not be accomplice to any evictions, and we think that is the case across our state. If you hear of any, let us know. But we don't think that there are currently any evictions for lack of payment. That doesn't mean that most landlords understand what's happening, and they're either saying we're giving you a month forbearance, or you spread that month across the next 12. That's what most are doing. But yes, there are probably some landlords that are not good landlords that you're stuck with because you rent from them, and they're telling you, I'm going to have you evicted, I'm going to have you evicted. That is generally a hollow threat right now. They're not likely to have any law enforcement agency actually enforce a conviction right now. And if you see that happening anywhere, please elevate that to us, because it is a locally distributed issue. But as far as we know, there aren't any occurring except under dangerous circumstances where they need to be, and state resources are not a part of any evictions during this crisis.
Governor, can you talk about I don't know if you've seen numbers about the loss of tax revenue for the state that's maybe you're aware of, maybe, I don't know, on a daily basis or a weekly basis? And then what about the message, two-parter, to the small businesses? They've reached out, and some of them are crying, some of them are so frustrated, others are saying we'll never come back. So kind of two parts. If you know the loss of the income tax or the tax revenue, and what do you say to the small businesses? Yeah,
well, certainly the one thing that would guarantee they don't come back is if they don't survive this epidemic. And I mean, to be clear, the death toll, modestly, I think President Trump said it would be a success if 100 or 200,000 people died. It's certainly possible that more could die. And even if that's not you, it might mean your customers, it might mean your colleagues, it might mean people that you do business with. So we have to get through this and survive in order to rebuild the economy. We also have to get through this as soon as possible. This can't be this state of condition for months and months and months where people are unable to conduct business and operate in a normal economic manner. So these steps now, and the more people are staying at home, the sooner that we can get through this and people can return to productive activities. Of course, the state will also be taking an enormous hit with regards to its income. There's going to be a belt tightening across the entire economy. Just as many families are tightening their belts, the state will be tightening its belt. Just as there's some help for families, families in the federal package, $1,200 per person, $500 per kid. There's also some help from the state. But just like for families, that doesn't, if many people are earning more than $1,200 a month, so it's not covering your full loss. If you're earning zero now, it's also certainly not covering the state's full loss. So there's going to be significant belt tightening. Again, hope. We will get through this. We will return to normal productivity, and we'll get things going again. We want that to be as soon as is possible, and it'll be sooner that we can do that, the more people are staying at home in these critical weeks. Telephone, please.
Hi, Governor. Ed Seelover with the Denver Business Journal. I know today's press conference is mostly on health information, but we're starting to see more groups, like a coalition of labor and worker groups on Friday, who are asking you for specific things, like 14 days of paid leave for workers to have coronavirus designations, or 30 days of job protection for those who need to self-isolate. Can you talk in general about how you are considering these requests that you're starting to get coming into you?
One of the very first actions we took when we around the time we protected nursing homes was to make sure on an emergency basis that workers have 3 or 4 paid days off if they are ill, so that they can be tested. If they do have COVID, they can then go on to the unemployment insurance on an emergency basis for 14 days. So that was one of the first things that we put in place on an emergency basis. It's really important. And now we're talking about the critical industries in public safety and defense and law enforcement. It's so important that if you work in one of those sectors, and you still are going to work, if you have any flu-like symptoms, any symptoms, or even a family member does, don't go to work. Call in sick. That's so important. We have the 3 or 4 days of emergency leave. You may have other leave through your job. You probably do. Use that sick leave, use that discretionary leave to help combat this. If you work in one of those critical sectors, it's really important that you don't go to work sick and risk infecting others. Yes.
Governor, two-part question. First of all, is it still important for people who are symptomatic to be tested? And can you address the disconnect that we're hearing between the public health messages about getting tested and what we're hearing from people is they're getting turned away from the hospitals? And we're hearing more and more of these stories of people who are symptomatic and cannot get tested.
Yeah.
Can you address that?
Yeah, if you have flu-like symptoms and you consult with your physician, you generally don't need to be tested. You should self-isolate at home. If you need medical attention, you need to seek that medical attention. But 80 to 90% of people who contract COVID-19 do not need medical intervention. And you can take Tylenol at home. I believe do not take Advil or ibuprofen as the current guidance, but you can take acetaminophen or aspirin for your symptoms. You can use the nasal decongestion things, Afrin, is that what it's called? Those kinds of things. But you don't need, unless you need medical attention, you shouldn't go out. I mean, for a couple reasons. You don't need to put others at risk of exposure by going out. I mean, our hospitals are overwhelmed as it is. You need to stay at home until several days after all of those symptoms have resolved, at which point you can then resume your normal activities. It's only 10 to 15% of people who contract COVID-19 who need medical attention, and if you are having that trouble breathing, if you are experiencing symptoms that absolutely require urgent medical attention, we want to clear the capacity at the hospitals for that. We don't want people who don't need medical intervention going en masse to the hospital, risking the spread of the virus and distracting our medical professionals from those who need medical intervention to save their lives. We did, just this last week, send out 4,500 testing kits to county health departments. Testing is rapidly gearing up, both with partners like UC Health and Kaiser, as well as the state lab, which is several times its initial capacity. That continues to expand. But if you are ill, stay at home unless you need medical attention. And try to avoid any exposure to others until several days, I believe the guide, 4 or 5 days after your final symptom is resolved, meaning your fever's gone, your cough's gone, your sore throat's gone, whatever that final symptom is, because the fever could go away earlier. You might still be symptomatic. Until the final symptom is over, wait 4 or 5 days and then go out.
Who should be getting tested now?
The testing is prioritized for clinical needs and for those who have direct exposure who are working in the medical professions. But additional testing is being done through our county health departments and many others. We continue to do epidemiological testing. There's some blood testing going on that's a trailing indicator detecting antibodies. That's scaling up as well. It has a role, just as fever screens have a role. All of these testing technologies have a role. Just this morning I was on the phone with the United Healthcare CEO about the changing protocols for the swab tests and the ability to go to shorter swabs, even Q-tips for those. But for the processing capacity, which we've gotten down to about 1.5 days from about 5 days where it was a week ago or 2 weeks ago, I'd have to the time frame was down to about 1.5 days to the equipment and to the personnel. If you simply have the symptoms, stay at home, assume you have it, because even if you have some other form of influenza, you're still contagious. Just stay at home and then only seek medical attention if necessary. And by the way, if you do stay at home, of the people that we're testing, about 20% are testing positive, and we're mostly testing symptomatic people. That means if you are symptomatic, roughly in our state, there's probably still about an 8 in 10 chance that it's something else other than COVID-19, about a 2 in 10 chance that it is COVID-19. That's not perfect because we're not just testing symptomatic people. We are testing healthcare workers and others and people who have been exposed. But the normal bugs are still out there. And if you have any flu-like symptoms, you need to stay at home, avoid spreading that, and if you need medical attention, seek it out.
Governor, a couple quick things. One, by what magnitude do you believe Colorado's coronavirus cases are under count? You said thousands.
Yeah.
And then also, what can you tell us about the person under 40 who died today of underlying health issues?
Yeah, so that's the detail we have. That'll be part of the 4 o'clock update, along with any other deaths. The partial update is 51. The partial number of cases is 2,627. Our public health professionals know that there are several times as many cases. They estimate there are several times as many cases that we don't know exactly how much, whether it's 5 or 15,000. We really don't have a beat on that. We will see this and get a better sense of it based on the trailing indicator of hospitalization, meaning those who have it today after the onset to ICU admission 10 to 12 days. So in 10 to 12 days, you can take the number of people who need ICU admission and extrapolate about how many people had of it today. Of course, the other variable there is how many need ICU admission. That could be anywhere from 2 to 10%. So we don't know, and it also depends on the demographics of who gets it. Could be a little lower, a little higher. But you'll get more information on how many people have it from the trailing indicators of how many people need to be hospitalized. Ultimately, how many people succumb would also be a good proxy for that.
Governor, over 400 people have been hospitalized. How should we read this data, though? Because you're not telling us who's been released from that. You said today that the average is about 20 days. When does that number begin to become an emergency number?
Yeah, 414 hospitalized now. We will begin to update that as we get that with releases, but most of the people who have been admitted are still hospitalized because it's a longer period of hospitalization. Maybe Dr. Moss can comment on that clinically.
Sure.
I mean, there are people that get admitted with COVID-19, and then there are ones that get critically ill from it, and they're different. When I was talking about the 2 weeks on a ventilator, of course they're in the intensive care unit, or 3 weeks in the hospital. Those are the ones that I take care of. So the people, and this sort of just started, so we started to see the first admissions come into the intensive care unit last week or so. So those patients are going to, if they're lucky enough to survive, are going to be there for a few more weeks.
Over 400, doctor, are in the hospital now. When do we begin to have, I mean, it's a problem now, I understand. When is it a serious problem? Is it 500, 600, 700?
I don't know the answer to that in terms of bed capacity around the state. I can tell you from an intensive care standpoint, having talked to the intensivists at several hospitals around the city, right now we're doing okay. But again, right now we're doing okay. How are we going to do in a few days or weeks? New York went from doing okay to being overwhelmed in several days that way. I hope that doesn't happen here. And as I said, the most important thing is that people have been working long hours for many weeks preparing for this and have models that are all modeled out on how we can take care of the people in the intensive care unit. One of the things that the governor said that's very important is we stop the elective surgeries, number one, so people didn't use the equipment, number two, so those people aren't using hospital beds. Okay, because some of those people would have to stay in the hospital. Those beds are now available that way. So a lot of measures have been put into place around the system to try to increase the capacity for patients that way. We'll have to see. But people are planning ahead, and I'm confident that we'll be okay that way.
And as we'll track over the next few days, again, if we've moved from doubling every 1.6 days to doubling every 5 days, we have to see what that number is. We do expect that doubling rate will slow further once the impact of the stay-at-home order goes in, which will be another week. But it is already reflecting the bars, the restaurants, the distancing guidelines, those initial efforts. But we really hope that as long as people are staying home, that doubling factor will. And what that doubling factor means is it doesn't mean we're not going to need those beds. It gives us more time to build them. We have literally people out building the beds, we're acquiring the ventilators, we're upgrading the workforce and getting ready for this. The more time we have, the more lives that we can save through the medical interventions that are needed. Telephone, please. Telephone.
Governor, this is Melanie Asbar with Chalkbeat, Colorado. I was going to ask if you expected to extend the school closures. It sounds like you're saying that's likely. Do you know when you might make a decision on that?
All school districts are under guidance that they should prepare for traditional in-classroom instruction to not return by the end of this school year. That being said, I like to be an optimist. Is it remotely possible that we can do that? It is, but it's very unlikely, and districts should be preparing for online instruction, virtual instruction through the end of this school year. Many districts, most districts have already canceled their physical graduation exercises. That is also sound to do at this point, at least make that contingency plan. It's very unlikely you'll be able to have those physical gatherings. We will work on what that formal guidance is over the next few weeks, but right now districts should prepare for that and assume that that's the case, unless there's some positive news that allows us to move in a different direction. In person?
Both still on the R0 level here in Colorado. Are you sticking with 3 to 4?
No, we're hoping that these social distancing measures are significantly reducing the effect of R0 here in our state. So when you saw that it was spreading at, doubling every 1.6 days and sounding the alarm bells and talking about that scenario where 30, 40, 50,000 Coloradans could lose their lives, that was if we did nothing, if we went around business as usual, we kept hanging out together, having parties, going to bars and clubs. Through those initial measures and with the traffic proxies that you saw, it likely reduced the social context in the 50-60% range. We're hopeful that once the stay-at-home rolls on, that's more in the 70 to 80% range. So the effect of R0 will be significantly lower because of these steps. But most importantly, the steps that individuals are taking to stay at home except when absolutely necessary. The trajectory of this in Colorado will be determined by your decisions and your choices. Your choice to not go out or leave your home and leave your family or housemates unless you absolutely have to in the coming days and weeks. We'll take one more from the telephone.
Hi, this is Erin Prater from the Gazette in Colorado Springs. This question is for either of you. Can you provide any kind of insights on the number of deaths in El Paso County? The county leads the state in deaths, at least as far as the last numbers I've seen. Why? Do we know why?
We have that. We'll get that to you. One of the reasons was one of the main areas, there was a bridge tournament there where I think a number of cases are connected to that. Who attends bridge tournaments demographically, people who are most at risk, in addition to the normal spread of the virus. What we want to make sure we also see is that there is greater support and compliance with staying at home in El Paso County. It's absolutely critical if El Paso County wants to reduce the hospitalization rate, the incidence rate, that people do their best to be able to stay at home unless absolutely necessary, just as they do everywhere else in our state. What is it? I thought it was, we'll get that number. It's all, by the way, every day, the numbers by county, covid19.colorado.gov. So every day, covid19.colorado.gov at 4 o'clock, the numbers are updated, and they are broken down by county, and you can also look at a county map, their heat map. So both of those are available every day at 4. Yes?
Bueno, una pregunta en español. Un mensaje para la comunidad de pequeños negocios.
Sí. Extendimos la fecha para pagar los impuestos del Estado del 15 de abril hasta el 15 de julio. Nos dieron los préstamos del Small Business Administration y todos pueden aplicar hasta $2 millones con bajos intereses. También estamos agitando renovaciones de licencia de varios tipos. La cosa más importante es la gente necesita esperar en sus casas porque lo más personas esperan en sus casas, lo más pronto podemos abrir nuestros negocios en este estado y nacional. Yes.
Buenas tardes, gobernador. El coronavirus comenzó realmente en casas donde cuidan ancianos. Ese fue el primer caso que se dio en Estados Unidos. Aquí, ayer se reportaron de que 10 casas aquí en Estados Unidos están infectadas. ¿Piensa que realmente no hubo la prevención correcta?
Tenemos nuestro equipo de expertos analizando la situación y tomando las medidas necesarias para detener la propagación, especialmente en las residencias de ancianos, porque la enfermedad es muy mal por toda la población, pero es más posibilidad de muerte para los ancianos y también personas que tienen condicionales de salud. One more phone question, and then we'll do one more in person. One more phone.
Hey, this is John Herrick with the Colorado Independent. Governor, the state has a goal of bringing about 1,000 beds online in May and about 5,000 this summer. What do you make of the timing of these beds coming online? And more specifically, how does the timing of these beds coming online align with your understanding of when we expect to see a surge on the healthcare system?
So the data set is not complete. We see the impact. We're beginning to see it. We'll see the next few days of the bars and the clubs closing, the schools closing. What we need to see is a successful, Coloradans need to be successful at staying at home, is the bottom line. They need to be successful at staying at home to squash the spread of the virus and slow it enough to have the beds that we need to build and the ventilators that we need to have to save lives. And so while we have some indicators of that from the traffic figures, we won't really know until we see the trailing indicators of how many are test positive and how many are admitted to ICUs in a week to 2 weeks. Final question from in the room? Yes.
Governor, and also maybe for the doctor as well. We're getting a lot of questions at CPR News about the survival, about people who are coming out of this okay, and we're wondering, is your office or is anyone tracking who survives, what we know about them, what the numbers are like?
I'll let the doctor respond first, and then I'll close.
It's a very important question. So for the people in the intensive care unit, the ones that survive, it takes them a while to get back to their normal state of health. They've been sick on life support systems for weeks at a time. But they normally, the symptoms that they have are usually weakness. They've been lying in bed, they get a little deconditioned. Sometimes they can even have direct problems to their muscles and nerves. So it takes a while to get better. Hospitals have set up what are called post-ICU clinics to care for these patients. They also sometimes will have some psychological problems, which you could understand, post-traumatic stress disorder, some problems with cognitive function also. So there is a real need and importance to care for these people when they go home. This is basing it on the ARDS literature and people that got it before the coronavirus, but it's a really important question, and I think it's going to be something we're going to be dealing with as a state and a country for a year or so down the road, because it does take a while for these people to return to their normal state of health. They don't just get better in a few days.
And remember, the greatest of all these, love. Love one another. And in the absence of reaching out to one another and being around one another physically, show that support for one another on the telephone, on email, on video chat. Really make that effort to help show how we can get through this together. Because love will win, and us being together without being physically together is exactly what we need to be able to get through this together successfully and save lives. Thank you.
You have been listening to Governor Jared Polis, the daily press conference, joined today by Dr. Mark Moss, a pulmonologist who works at the University of Colorado Hospital on the Anschutz campus in the ICU ward, bringing a very personal touch to some of the numbers. But those numbers and those dates and everything that has been covered in that more than 90-minute presentation talk about financial, academic, medical issues, and sadly those statistics as well. The partial update as far as the state of Colorado, now more than 400 people listed as hospitalized, and the death toll in Colorado has climbed by 4 to 51, most notably to some the first death of someone under the age of 40 here in Colorado due to COVID-19. The governor touching on a wide variety of topics, including his stay-at-home order statewide that has an expiration date on it now of April 11th. That was always said to be flexible, even hopefully that it might be lifted sometime sooner. Now with the presidential's social distancing guidelines pointing towards April 30th, the governor indicated that's more likely a target for the state, but that does remain in flux. We asked about schools, and he said it is very likely, of course, that schools are not likely to resume this year in Colorado, so there'll be a lot more coming up on that. Dr. Mark Moss also addressed what's happening in ICUs and telling personal stories about those frontline responders. It is National Doctors Day, but those doctors, those nurses, all of the people who have to come in contact with people suffering from COVID-19, what it means to them as well. But he also talked about 72 patients that they have that are positive at their hospital. 37 of them are treated in intensive care, and 33 of those, that's 89% of those they have in intensive care, are using some sort of ventilation. So it is certainly trying times indeed. Dr. Moss also adding to the governor's plea, knowing that we're going to be needing more beds, more masks, more ventilators, and the like. And in those pleas, asking, even insisting that people of Colorado maintain and understand what social distancing does. So there was a lot in there, and there certainly will be more. Again, the governor pointing towards the normal 4 o'clock update, still 2 hours away, as far as the statistics of what's happening in our state due to COVID-19. We will also be with you at 4 o'clock, 4 o'clock at 9 News. I'll be joined by Kim Christensen then. We'll have much more on this a little bit later. Thanks for joining us.